Yeah, it's been nonstop for doctors and nurses at this hospital where the intensive care units are at near capacity. They're telling me that nurses are working 16-hour days treating some of the sickest COVID patients. For lead registered nurse Melissa Bennett, it's another emotional day on the job. She walks us to the ICU where multiple coronavirus patients are in one room, lying on their stomach, breathing through ventilators. Behind these curtains to the right of your screen, Bennett says are patients who are in their 20s, 30s, and 40s, dying or barely holding on.
I have seen too many patients die, especially over the last few days.
At overrun hospitals on the Treasure Coast, an available bed like this one is hard to come by. This team of 60 nurses are all struggling. The hospital's now at a tipping point.
I have had to console teenagers who have lost their mom and their dad. And as a mother, that is traumatizing.
In an emotional press conference, Cleveland Clinic doctors and executives said that the highly contagious Delta variant is amplifying the number of COVID patients. In some locations, hospital staff only have oxygen for the next 2 days. Nurses and doctors have also been reassigned to COVID units.
Yesterday, we had 192 COVID patients. Today, that number is 213.
Joining the press conference in a video call are doctors in Indian River County.
We have had to open new areas within the hospital for COVID-19 care as our previous units have reached their capacity.
No diagnosis should take up 50% of our hospital beds and 80% of our hospital resources.
So CBS 12 News asked if the hospital system will push Governor Ron DeSantis to issue a state of emergency. Is there a need for a state of emergency that would allow you all to get more access to the resources that you desperately need because you're seeing record numbers?
Anything that improves supplies, access, those sorts of things that prepares us better for that would, I think common sense tells us, would be helpful.
Because they need all the equipment and personnel they can get to help save lives. Today, doctors are stressing the importance of vaccines, saying that it's the only way we'll get our hospitals back to normal. Reporting in Stewart, Denise Sawyer, CBS 12 News.